Hello and welcome to my channel. If this is your first time here, I'm Nurse Alyssa, and today I just wanted to go quickly over what I actually do as a wound care specialist online, because I do offer wound care consultants to optimize the healability of a wound. So I get this question a lot: what do I actually do? So that's kind of what I wanted to go over today. So as a wound care specialist, we're trying to always heal wounds. We have to look at the whole patient. Okay, we can't just be looking at the hole in the patient. Okay, the wound is just one part of it. There's something that has caused that wound. Especially in chronic wound care, we need to look at the patient as a whole and see how we can optimize their body and optimize healability of that wound. So that's exactly what I do. So I did get my training out of the University of Toronto to become a wound care specialist, and I was working in the community setting. So that's really where I gained a lot of my experience and knowledge. So I was in a clinic setting and also going into patients' homes. So that's where I got a lot of my wound care experience, and I decided that I wanted to bring it online to help more people, because there are not a lot of wound care specialists out there, and I wanted to be able to reach more people. So what I specifically do, if you are my client, you would go onto my website, which I'll link down below and I'll link up above here. But you would go onto the website, you would book an appointment with me, and the appointments, they're put for 45 minutes, but really however long it takes for me to do a full assessment of your wound. I will ask you to send pictures beforehand, so I can have a really good in-depth look at the wound and know what I'm dealing with beforehand and kind of prepare. And then when we hop on our Zoom, we'll go over a full assessment. So I'll ask you a lot of questions. I'll ask you questions about medications, any disease processes you have going on, such as diabetes, high blood pressure, high cholesterol, anything like that, autoimmune diseases. We'll go over everything. And then I will also look for clinical infection and see if there's any possible biofilm. We'll discuss how long you've had the wound and any previous treatments that you have used, what you have done already, what's worked, what hasn't worked, if you have any allergies, and we'll make a plan. So the plan will consist of nutrition. So you will get my nutrition for wound healing book. I'll send that over to you, just so you are getting all your vital nutrients that you need for wound healing. And then we'll also discuss how to optimize wound healing for your specific wound. Okay, depending on the type of wound that you have, say a pressure ulcer, we need to remove pressure. Venous leg ulcers, we need to get you fitted for compression stockings, get you sent to the doctor or specialist, vascular surgeon, to determine if you can wear compressions. Because if we're not fixing the problem that's causing these wounds, the wounds will either keep coming back or they will never heal. Okay, so that's what I do. I like to point you in the right direction. I give you all the information that you need. I'll give you suggestions of any wound care products that I think you should be using. Now, you can go back to your doctor and discuss this. You will get a paper form, and it'll have your whole treatment plan on there that I determine that you should be using from my assessment. And you can talk to your doctor about that, or we can get all your supplies online. Normally you can just get them on Amazon and they get shipped right to your house. But I go over all of this with you and make sure that you have a really good idea of what you need to fix that wound. I see it so many times in wound care that people are just looking at that specific wound. Okay, slapping products on it, it should heal. But if we're not taking care of the actual problem, it's going to be a reoccurrent issue, or the wound is not going to heal. Okay, now this is with chronic wound. If it's just an easy cut, whatever, I can help you with that too. But for the most part, I deal with chronic wounds that really aren't healing. So that's what I do. If you have any questions, please do drop them down below and I will definitely get back to you. And once again, I have my website in the description and you can book online there. Okay, I hope you guys have a wonderful day, and I hope to catch you in my next video. Bye for now.